Okay, Ben, so can you tell us a bit about this new guidance on restraint, please?
2 weeks ago now, the Minister launched new guidance called Positive and Proactive Care, reducing the need for restrictive interventions. So this is guidance that we hope is going to help people out there when they're providing services and they're faced with people with challenging behaviour or in all sorts of situations. And I think the driver for it basically is to move away from restrictive interventions as the norm, to a place where we're actually providing recovery-based care in environments which are therapeutic.
Okay, so the big plan, the big idea behind it is introducing positive behaviour support to meet people's needs so that restraint no longer becomes necessary.
Sure. Positive behaviour support is one model. The guidance that, and the guidance is actually flagging that up. But we know, or I know, that it's not sort of a common model for lots of people working in mental health, basically. But it is one model that's been shown to work in the field of learning disabilities. So it's a possible way forward, I guess. But there are, if other people have got other models that work equally well, then that's fine. The whole thing is about not using restrictive practices as the first line of interventions, I suppose.
So that people's needs are met in other ways.
So that people's needs are met in other ways.
And what do you hope? How do you hope things will be different, say, in 5 years' time?
In 5 years' time, first of all, I'd like to see the number of restrictive practices reduced, and we need to do some work about how they're recorded and reported. But I'd also like to see a complete change in the culture and the nature of the services that we provide, so that people are treated much more humanely. That nurses feel much more confident about the way that they deliver care, and whether or not that's through PBS or not. And that care is much more personalised and person-centred, and we're not resorting to all those restrictive interventions that we've been used to. So whether it's physical restraint, whether it's seclusion, whether it's chemical restraint, we've got other means of helping people, I guess, when they're in crisis.